We're going to be doing longer-term follow-up to look at overall survival. This was a first interim analysis for overall survival, so we'll certainly have more data. But I think for this agent in particular, but for the class of agents as a whole, they have moved into the adjuvant setting where they are being studied in large phase 3 proof of concept trials to see whether or not these improve disease-free survival and overall survival in the early disease setting. That ultimately is where we want to go with new agents in breast cancer, because that's the area where we have the potential to cure a patient with breast cancer. One interesting aspect of this trial that we looked at was time to chemotherapy, defined as the time from randomization on the trial to the first post-randomization use of chemotherapy. We also included censoring for deaths before chemotherapy in this analysis. What we saw was that patients in the control arm had about a 22-month median time to chemotherapy, whereas in the combination arm with abemaciclib plus fulvestrant, we saw a median time to chemotherapy of about 50.1 months. This is a pretty significant increase, and I think a valuable one for patients who would certainly prefer to forego the rigors of chemotherapy for as long as possible.